So moving on to fibre, there are two different types, soluble fibre and insoluble fibre, and they work in quite different ways in our body. Soluble fibre is the one that helps lower our blood cholesterol levels. So that binds to the cholesterol and takes it out of our body. It assists with our blood sugar level control as well, our diabetes control. So soluble fibre is the insides of fruits and vegetables. So they're things like, legumes and breakfast cereals, oats like our porridge, barley, seeds and nuts, the inside bits, and also psyllium. Can you think of the other name for psyllium? It's Metamucil, that's how it's marketed. That's got a bit of flavour and sugar added to it so that it tastes a bit nicer. So insoluble fibre is the one that's good for our bowel health. So that prevents constipation, diverticular disease, which we'll cover in just a minute, and maintains good levels of healthy bacteria in our gut. It also reduces the risk of colon cancer, and I'll explain to you why, and hopefully this will help you to eat more fibre because it is very important. In our intestines, if you've got a cancer cell, a bowel cancer cell, and you don't eat any fibre, what can happen to it is it can proliferate and it can get bigger and it can grow, it can break off, it can get into your bloodstream, it can travel around your body, and before you know it, you've got metastatic, which just means that it's spread, colon cancer. And you can actually die from that, which is terrible. But if you eat fibre, what fibre does, the insoluble fibre, is it swells. So it soaks up water, so you need to have enough fluid with it, and it swells to the inside lumen of your intestines, and it actually acts like a broom, and a big broom, and it sweeps out all of the junk, for want of a better word, all the way through, and if there is a cancer cell, then it takes it out of the body and we're safe. So you wouldn't even know that you had bowel cancer to begin with. So that's why it's important to have fibre very regularly. So insoluble fibre is the outside of things. So things like your brands, brown rice, nuts, and your fruits and vegetable skins as well. Now some people peel fruits and vegetable skins, but then you lose a lot of that good fibre. Why would you do that? So you can peel, things like potatoes. Some people peel carrots. My grandma peels cucumber, one on, one off, one on, one off, all the way around, and then chops it on an angle, and then it's pretty. But actually, the best thing to do is just to wash it, hand wash it. You don't need to use soap or anything. And then, so just a good rinse, and then you can actually eat the skin. Obviously not things like oranges. You want to be able to get rid of that skin because that's not particularly pleasant. So another common question people ask me is, which bread do I choose? I'm at the supermarket. There's so many kinds now, which one is best? I always say, the heavier it is, the higher the fibre, and that's the one you want to go for. So there's a bit of a continuum with bread. Starting at the very top, lightest, the fluffiest, the country split type of bread. That's almost like you could play volleyball with it, it's so light. So you want to try and have something, and that shows that it's quite easily digested and it hasn't got a lot of fibre, hasn't got very many grains in it. So you've got your white bread at the top there, which is, the least useful. And we want to look at fibre per 100 grams. So turn over that bread and have a look at the 100 gram column and how much fibre's in there, and then have a look at the one that you're thinking about getting, compare it to a different one. So white bread, then we've got sourdough bread, not very much fibre in there again, as nice as it is, about 3 grams per 100. Then we've got the white high fibre bread, and that's good for people who genuinely, either have dentures that the seeds get in and annoy them, or they just don't like grain bread. That's good for that type of person. And they're quite good with putting the fibre in there now. So they used to be about 3 or 4 grams of fibre. Now they're getting them up to about 7 or 8 grams of fibre. So you've got that benefit in that white high fibre bread. Then you've got chia bread at about 4.5, along with your multigrain bread at about 5. Then light rye, wholemeal bread. So you've got multigrain, which is white bread with the seeds in it. And then you've got the wholemeal, which is the milled grains and put into the flour, and then they make the bread with that. Does that make sense? And then we've got the best one even after that is that wholemeal bread with the grains in it. So it's called wholemeal whole grain. It's a bit harder to find, but have a good look when you're shopping next. And then we've got the dark bread. So we've got the Bergen bread and the spelt bread. Now I always say that if you like them, then they like you as well. So they're a good choice. However, some people do find it's a bit like eating a brick, really. So if you do like them, then they're very high in fibre. Your sprouted spelt breads can get up to about 11 grams of fibre. So hopefully that helps answer your question about bread. So when we're talking about fibre, things like chia come up, the magical grain. So chia was another one of these fashions that we sort of had recently as well. They were putting chia into all different kinds of breads, and people were taking chia seeds for breakfast. Well, are they as good as they're cracked up to be? Yes, they are high in omega-3. They're ALA. So remember that the ALA is converted to EPA and then DHA, and we lose a lot along the way. They're no higher, however, than linseeds, which are also high in ALA. They are high in fibre, particularly soluble fibre. Most of our seeds and grains are. They're high in protein, which is great, but so is wheat. They're high in calcium, but so are our almonds and sesame seeds as well. They do contain antioxidants, but a great source of antioxidants are our fruits and veggies. They're high in unsaturated fat, but not as high as sesame seeds or nuts. So, although they are great, when you compare them to all the other nuts and seeds, there's nothing particularly special, magical, or amazing about them, just in the context of a healthy, balanced diet with all your other grains as well. So how to include more fibre? Choosing your heavy wholemeal, whole grain breads and cereals. Choosing legumes, the often forgotten source of protein and fibre. Choosing the whole fruit and vegetables, so not peeling them if possible, just give them a quick rinse. Half and half, so a bit of a trick. If your child, husband, wife won't eat wholemeal bread, put a piece of white bread on top and slip a piece of wholemeal or whole grain underneath. And making sure you have enough fluid as well. So that's very, very important because fibre actually can't work without enough fluid. So what it does is it relies on that fluid to be able to soak it up and increase sort of its weight and density to be able to soften and do its job. So if you're taking something like Metamucil, what we recommend is obviously what's recommended on the packet. So if it's a spoon or two, putting it into a large glass of water, mixing it up and then following it up with another large glass of water. Because what happens if you don't do that? Often people say, oh, fibre, I tried that and it makes me constipated. Well, that's because it gets stuck because it can't do its job because it doesn't have enough fluid. Have you ever put Metamucil into a glass and the phone's rung or something and you've run off and you've gone, oh, and you've come back and it's stuck in the bottom and it's all hard and you're looking at it and you're like, oh, it's like a gelatinous mass in the bottom of that cup. And that's what happens on the inside if you don't get enough fluid. So do keep that fluid up. And of course the best choice is water to drink. So the question here I'm going to answer is, I have diverticular disease, can I have nuts and seeds? The question is yes. About 5 or 6 years ago, we thought that patients with diverticular disease had to avoid nuts and seeds and that they couldn't eat them. But the thinking has now changed. So what diverticular disease is if you put pressure in your bowel, either from being constipated long term, so even if it was when you were younger, or having multiple pregnancies with large babies, or weightlifting or heavy lifting at some stage, what happens is that pressure causes an outpouching in the actual lumen, so the wall of your bowel, or your small or large intestine, and you get these little outpouchings. And they used to think that nuts and seeds got stuck in little outpouchings. And what happens is sometimes, and it just happens, there's no cause that we know of particularly, so no food that you eat that causes it, you have a flare-up of that diverticular disease, and that's called diverticulitis, and that's extremely painful, and sometimes you end up hospitalised. So the point here is that you don't need to avoid nuts and seeds. We used to think they got stuck in the pockets, but there's actually no evidence that that does happen, and that's supported by the Gut Foundation as well. So nuts and seeds are fine for everybody as part of a healthy, balanced diet, unless your doctor has told you that you can't have them for some reason. So we do want to chew them really well, but there is no need. And there's no specific foods that do trigger or prevent an attack of diverticulitis.